So as the Omicron variant continues to surge, so obviously do your questions. Let's get you some answers. Joining me now, Dr. Lynora Saxinger, Dr. Zain Chagla. Thank you both for being here. We have a few viewer questions to get to, so why don't we start with those and with Tony.
Hi, my question is about the mix and match vaccine process that we started out with. My first dose was AstraZeneca, followed by a second dose of Moderna. Now that I'm eligible for my third booster shot, I'm wondering if I should stay with Moderna or consider Pfizer as an alternative. Thank you.
So, Dr. Saxinger, I mean, I know some people are grateful to get boosters at all, but to Tony's point, do you want to take that on?
Sure. Well, I mean, people who've had AstraZeneca, Pfizer have immunity antibody levels that compare very favorably with double Pfizer. And so we know that the combination of an mRNA with AstraZeneca is very good. We don't have direct data for which booster is best in that scenario, but there was some recent studies out of the UK that showed that basically AstraZeneca is well boosted by pretty much anything. And that the mRNA vaccines, maybe Moderna has an edge over Pfizer. So all that to say, I don't think there's a wrong answer. I don't think that we can say with certainty for any individual. I think either would be fine. Slight favor for me in terms of Moderna, because this individual already has had that and knows the side effect profile.
Okay, and Dr. Chagla, as people wait for the boosters, sometimes struggle to get them, what is happening to their immunity? You know, is there, maybe this is a dumb question, but is there a point at which someone who is double vaxxed is really no longer vastly more protected than an unvaccinated person?
Yeah, so, immunity is incredibly complex. We have different types of cells, T cells, which kind of deal with our severe or hospitalization, the complications of COVID-19, versus antibodies, which are part of the hospitalization piece, but also a part of that, protecting one from getting COVID-19 to begin with. And so there is a weaning of efficacy as time goes on from people from their antibody levels, so more chance of them getting COVID-19. But study after study after study, at least with Delta, shows that people that have had a primary series of vaccine, 2 shots, have significant protection, even 25, even 30 weeks out from their primary shots. And so we can be comfortable that people are not going to revert back to ground zero, that there is some baseline level of immunity that we're even seeing with Omicron in South Africa amongst people that were studied with 2 doses, where they still saw 70% protection against hospitalization.
Okay, and Dr. Chagla, I'll get you to take this next viewer question. It's from Mark.
Hi. What is the latest that we know about how severe or how mild Omicron is, and how effective will a third booster shot be against it? Thank you.
Dr. Chagla, to the last part of that question in particular, what do you think?
Yeah, I mean, so the severity piece is up in the air, and there's data from South Africa suggesting less so, but is it immunity? Is it because of immunizations? We're not entirely sure. We do know there's good data from the United Kingdom looking at people that have gotten Omicron, where 2 shots of Pfizer kind of give them 30 to 40% protection, with the booster goes up to 70% to 80%. And similarly, actually, with AstraZeneca, 2 shots of AstraZeneca don't give them much protection, 10 to 20% against symptomatic COVID-19, not against severe. But getting a booster shot gets them back up to 70 to 80%. So good data really suggesting that a booster will offer some benefit against symptomatic COVID-19 and likely offers a benefit against severe COVID-19.
Okay, so Michelle has a question I'm pretty sure is on a lot of minds right now about the possibility of more restrictions. Let's have a listen.
As Omicron is a new variant, we know that there's a lot to learn. What have we learned to this point? And how long will it take before we know if we need to shut down?
Dr. Saxinger, maybe that's the magical question. How long before we know if we need to shut down more?
I think that what people are looking at are 2 things. They're looking at how rapidly the case counts are going up. And Omicron has shown itself to be extremely, extremely transmissible, much more than Delta. And pretty much everywhere that started tracking it is seeing a very similar, incredibly alarming upswing in cases. It's very aggressive. The second part of the question is how severe the infection is. And there we're seeing slightly different signals from different places. Early signs would be that it might not be as severe as Delta was in terms of hospitalization, but you can't really compare that between populations very well. I think that at the moment, a lot of us are looking at this as saying the numbers are going up. We would expect logically that hospitalizations will follow to some degree. how much capacity do we have in our system right now to absorb that and still provide care for people? And I think the answer in a lot of places is the hospitals are already full, trying to catch up from our previous problems over the course of the pandemic. So I think our surge capacity is low and we should plan accordingly.
Okay, here's a question about travel sent in to our team at Ask CBC. We are a seniors couple, 66 and 77, both with boosters, traveling in our own vehicle for a 6-week booked vacation in Arizona. Should we go or not? Dr. Saxinger?
No, I try to resist telling people exactly what to do, but if I had relatives telling me they were planning to go to the US right now, I'd probably be advising them against it because there is still a very real risk of a surge that could result in local healthcare changes. So even if you're traveling and you're well protected against COVID-19 and you're very careful, if you had some other health event, you might not be able to access the care you need as easily. And then, of course, there's the whole question about restrictions at the border, et cetera. So while things are changing so quickly and while we're learning so much about Omicron, I would be really suggesting people consider pausing in their plans and kind of see which way things are going over the next little while.
Okay, good caution there. Last question to you, Dr. Chagla. You know, in everything we're learning about the dangers, is there anything we're learning about treatments that gives you hope at all?
Yeah, absolutely. So we've had, monoclonal antibodies. We've been using them. They've been reducing the risk of hospitalization and death amongst people who are qualified for them. We're going to have 2 new antiviral compounds hopefully on the market very soon. The US FDA is going to approve them this week. And we have other medications that are being repurposed, like fluvoxamine, which is an antidepressant, which may have some benefit as well for patients. And so, getting COVID-19 is not just waiting to end up in hospital. It is a lot of steps we can mitigate beforehand. And it really is going to change our way that we live with this disease in the sense that we offer people treatments and we mitigate the severe complications and allow most people to recover at home.
Okay, that sounds a little bit better. Dr. Chagla, Dr. Saxinger, thanks very much.
No
Thank
problem.
you.